Qabayan Radio 94.3.
The first and only Filipino radio station in Qatar, has 11 million website hits and 1 million online followers.
Advertise on air, online or on ground, as our packages include
Radio commercials, live mentions,
time check sponsorships, segment sponsorships,
program sponsorship, live guesting, and many more.
Go to www.qabayanfm.com.
Follow us on socials at Qabayan943
and call our contact numbers now for more details.
You can also email us at info@qabayanfm.com. Advertise with us now.
Radio 94.3. Welcome to the second hour of the After Shift. But for now, as I have said, may special segment tayo for tonight. And we have the second episode of The Doctor is In. You are still with Trish for The Doctor is In. And for tonight, I am joined by our guest speaker, Dr. Mohammed Mansur Ali. He is a specialist in orthopedics at the Orthopedic Department in Al Ali Hospital. So, good evening, Dr. Mansur. Yes. Okay. Doc, how are you tonight?
I'm fine. I'm great.
Yes. You're doing good.
Yes.
Did you just get off work?
Yes, I did.
Yes. And for tonight, we're talking about low back pain because in the wake of the work from home atmosphere, the work from home setting,
Yes.
many people, as you have said while we're there and in the other room while we're discussing off air, you have been having patients who've been experiencing lower back pain. So for my first question, what exactly is the lower back pain? And you have visuals here for the model.
Yeah. I mean, pain in the back, the lower back, you know. I mean, just around your waist.
Yes.
Having pain over there, that's a segment where around your waist, that's where you have the pain. That's where you refer it, usually lower back.
Lower back.
As you have the spine here.
Yes.
And then lower down around your waist level and then above that. And that is where you refer it as the lower back.
Yes.
You know, just below your rib cage.
And what are the common causes of lower back pain?
Well, it could be multiple. It could be lifestyle related. It could be with your most common is usually what we see here is lifestyle related. It's with posture, with your ergonomics, with the work. Primarily, sedentary life, or say now, since as in the wake of COVID, and since past 9 months or more,
Yes.
we are working from home. Lot of people who usually used to go to offices, now they are working from home.
Yes.
So well, there are long hours of sitting with improper chairs, possibly at home.
Yeah.
So that could, long hours, 8 hours, 9 hours, or even 10 hours, or sometimes there's no time limit for work from home, and then that has effects on your back and your posture, on your muscles, and then that does not going out, being in room, and then that does have an effect. I mean, it reflects in different ways, and one of the ways is having back pain.
Yeah, so basically, what you're saying is our work habits, especially at home, like the posture for long hours and just staring at your screen and
Yes.
sitting.
Presently, especially for this present scenario, what we are in, the
Yes.
whole world is facing, So with that scenario, yes, one of the major factors, common factors.
Yes, is
I mean, there would be more serious problems of the disc and all that, but that comprises less of patients, having those major problems. Most of it, if you see around 10 patients, 7 to 8 would have problems related with lifestyle, and especially with this situation we are in now. It's much better now, at least we're going out, but
yeah,
if you look back a month ago or so,
a lot of
yes,
patients
so it's lifestyle,
come to you.
postures, sitting, desk work most of the time, with improper chairs. So yes, that could be the major cause for the back pain now,
Yeah.
or an added cause, I would say.
What about sleeping habits, Doc? Does that also, apply?
Well, sleeping habits, yes. I mean, sleep less. Sleep is very essential, right, for everyone. So you have to have that required sleep.
Yes.
So sleeping habits, if you don't sleep enough, you're tired, you're stressed, you're fatigued, and then again that reflects in aches and pains and depression and back pain, muscle pain. Muscle pain generally is what it'll reflect in.
Yeah, like the sleeping positions.
Yeah,
that
the
also?
mattress is very important. Firm mattress, the quilt, and all that, and again closed environment, too much of an AC, air conditioned rooms.
Yeah,
Of
so
course, it's hot here. It's a Gulf region, so it's warm. So most of the time of the year, you're using air conditioners. So that also has an effect.
yeah, so little things like that. No,
Yeah, they
we
do
don't
matter.
usually notice, but
Yes, they do
matter.
They do matter. Yes, a lot.
And for you, Doc, how do you think has work from home affected our lifestyle and the general condition of, clinically bones and joints?
Well, I feel it has affected because you're not moving out. I mean, you used to be social, going to work, at office.
You walk
I mean,
around.
yeah, I mean, it's work, right? I mean, you're not meeting friends at office, but then you're interacting with people. There is human interaction.
Yes.
And then you're staying back home, you're not meeting, you're not supposed to meet, basically, right?
Yes.
Social distancing.
Yes.
It's for good. But then the other effects is that you're secluded, and then again, not much of physical activity, exercises, and then work from home, again, it wouldn't have a punch in and a punch out time.
Yeah.
Right? So you're just working. If you sit there in front of the monitor, then you're sitting from 8 o'clock in the morning till perhaps at office you work till 4 or 5. But here probably you need to put in more time.
Yes.
So that again, you're not moving, and then the chairs are possibly are not proper at home. At least you have a proper office chair in your office,
Yes.
but not many people would have a proper office chair back home.
Sometimes you just do your work.
Yeah, you're lying down.
bed?
You might be sitting on
Yeah.
on a sofa, on a settee, or
On the
probably
couch.
sitting on a couch or on a bed.
And then you lose sense
Yeah.
of time, so you
Yes,
don't know
and the
anymore.
posture, and then
Yeah.
aches and pains. That's how it builds up.
Yeah. So, Doc, how long does lower back pain usually last until you know that I should go see a doctor now? Like, how do you know if it's serious already?
Well, you know serious if you have injured yourself, if you have had an accident, if you've had an injury, and then of course, if it's a minor one, if it's a minor fall here and there while walking in the house or outside, well, it could just be with just one painkiller or Panadol or something, it will get better. But if the injury has been serious, it has been a major accident, of course you need to see a doctor. And then, well, I think home remedies, bit of a rest. If you have back pain, bit of a warm compress. You take a small towel, warm it up and apply it on your back, or a rub-on lotion, something like that. If you try to do some home remedies, warm shower would help you, something like that. It'll ace off your muscles, not ice, but something warm, a warm cloth, or a balm, or a rub-on lotion.
Yeah, because some people would apply like ice. Something cold.
Is more for sports injuries, ankle injuries, and you're playing football.
Like
you fall.
sprain?
Yeah, sprains, exactly. Yeah, for the back pain, if you have a spasm, if you're moving, you turn suddenly and you have a spasm, then probably you need a warm compress.
Yeah.
And then you're looking at around 2-3 days. I think you could try it out. If not, then I think it's time to seek a medical advice.
Yeah. So if this goes on for like a really long time, for weeks and months, is that because I've also upon researching, I've also read something about spinal cancer, so it can be as serious as that?
Well, it's a general term, right? I mean, for spinal cancer, of course, I mean, you wouldn't know until you know it. There'll be some signs and but see, you need to look for common causes first.
Yeah.
If you're sneezing, if you're coughing, you need to first look for allergy.
Yeah.
You need to look for some pollution outside. You don't have to look for lung cancer, right? That's last of the things you look for.
Yes.
You look for most common, what's the most common cause? I'm sneezing, is it allergy, is it infection, or something like that? You go from basic, right? And then you go to some rare conditions. So if it's not getting better with these remedies, then of course you could do a scan, you could do an X-ray, investigations, there furthermore. That is why, I mean, you seek medical advice.
Yes. So, Doc, statistically, lower back pain can most of the time be cured. Yes.
Yes, why not? It's curable. Yes, of course.
And also, you've mentioned home remedies, so that's the warm compress.
Yeah, you could see, like, it depends again, right? I mean, if you have an accident on the road, you're driving, you have a major accident, I can't expect you to do home remedies. But if it's a sprain, like for example now in this situation, working from home.
Yes.
So the home remedies could be, you need to do some bit of stretching, you need to do
exercise,
bit of walking. I mean, now at least you can go outside, but otherwise you need to walk.
Yes.
It's good for your metabolism, it's good for your heart, it's generally good for your digestion and everything. And then it warms up your muscles, right? If you play football, you need to warm up. If you play tennis, you need to warm up.
Yes.
So warm up is just to prep up your muscles. So if you're working, if you're sitting long duration, then I would recommend you do a bit of exercise, bit of stretches, things like that, and then warm compress, as I said, warm shower. These are the things. Stretching and exercise is what I would suggest basically.
Yes.
Give half an hour of a 24-hour time to yourself. For some stretching and some exercises. There are simple exercises which you could do at home.
Yeah, just so there's some bit of an action for our bodies.
Exactly.
Yes. And Doc, we're not just talking about lower back pain. There are also pains that we experience in the shoulders, in the knees, and you also brought in mono for that.
Right.
So what can you say about the pains that we experience, not just in the lower back, but in other parts of our muscles and our joints or bones?
Well, here, I mean, particularly pertaining to this region here in Gulf, well, one of the causes for back pain, muscle pain, joint pains, fatigue, as you said, being tired.
Yes.
Could be because of low vitamin D. Vitamin D is very low in Gulf. A lot of people have low for various reasons.
Yes.
So that needs to be checked. It affects your mood. And then you get tired, fatigue, dull, run down, and this is what you feel. So vitamin D is what, if you have these symptoms of, you have these aches and pains, ache on the back, then ache over here, and then it keeps on moving from one place to the other place.
Yes.
It's the shoulder, then it's the shoulder blade, it's your arm, and you're tired and you're fatigued. Then I think a basic test like vitamin D has to be done, and if it's low, then there is enough available prescription medication for that. Yes.
But what do you recommend, Doc, for that? So just again, the exercise.
Well, yeah.
Which is really important.
Diet.
Diet.
Vitamin D.
Yes.
So, which food? Like you can have it in,
Like fruits.
You can have it in spinach, green vegetables. You can have it in cheese, egg, and in chicken and non-vegetarian food, and they'll be rich. Milk, cheese.
Yes.
These are good sources of vitamin D. So you try to have that, and again, bit of exercise outside, walking outside. This will help your metabolism, and then it will also help the metabolism for vitamin D in the body.
Yeah, and Doc, I just want to ask about chiropractors.
Well, chiropractor, yes, it's quite interesting.
Yeah.
There are two fields. Physiotherapy is one. Physiotherapy is about physical therapy, exercises, postures. They do some electrical stimulation for your muscles and things like that. Chiropractor is kind of a part of it. It's also kind of an extension of it. I would say it's scientific massage. It's not like you have the spa massages and things like that, and this is more like a therapeutic massage, trained medical massage. It's more manual with the hands.
Yes.
So they try to break the stiffness around your joints, around your spine, mainly around your spine. You have these tight knots and spots in your back.
Yeah.
So they try to maneuver it basically with the hands. Kind of, it's tricky to break it, to crack the spine in a medical way.
Yeah.
Not in a crude way, or these are all medically trained personnel.
Yes.
So that's what chiropractor is. There are quite a few here.
Here.
Yeah, in Qatar and generally in Gulf, there are quite a few. So yes, again, and then but patient selection is important for that. Some of them who have a disc problem, who have a major disc.
Disc, Doc, is where exactly in there?
Well, this is the spine now. If people who are seeing live on the video, this is your spinal, your backbone, right? So it's like a column there, and this is your vertebrae, or these are like bricks. These are blocks of bricks one on top of the other, and this what you see here. This one is the disc.
Those are the discs.
Yes, the cushion.
Okay.
So basically, it's like a cushion in between two bricks.
Yeah.
Yeah, there are two bricks, one on top of the other, right? This is how the spine is. So the disc comes in between. Normally, we all have disc.
Okay.
All of us have disc.
Normally,
it's there. By nature, it's God-given. This is the disc. So the disc, it's like a shock absorber. You know how you have a shock absorber in a car?
Yes.
Right? So it gives cushioning. It gives height to your spine, to your back.
Oh, so that's what it is.
It gives you height. It gives you the cushioning.
Yes.
The impact. So it spreads the impact. That's what it does. This is the disc. It's like a cushion. It's sponge. So when you say you have a disc, everyone has a disc. It's normal. But generally say I have a disc. You say you have a disc when there is a. See, this is how it is. It's like a sponge. Sometimes for various reasons it can slip out. You know how a soap would slip out of your hand?
Yes.
It's the similar way the disc might slip out, and then it might press on these nerves. You have the cord, right? It's like an electrical circuit.
Yes.
It's like an electrical circuit running down from your brain on the top till down. It runs along your spine. So if the disc slips out and goes back, it might press on the nerves. So and when it does, it's basically trying and going and pinching the nerve. Right? It pinches the nerve. Right? It compresses the nerve.
Yes.
And then you have symptoms like your pain running down your leg, like an electric current.
Oh.
Yeah. You have your right leg, left leg, you have like a current running down your leg.
Yes.
What you call generally the term sciatic pain, sciatica, it's very commonly used even if you Google.
Okay, so that's what it is.
That's what it is. So disc is there normally, everyone has a disc, but when it slips out, that's when you call a slipped disc. Something which is slipped out of its position.
Doc, what happens if it slips?
As I said, if it slips out and it presses on these nerves.
That's how it hurts.
Yeah, so the nerves are like wirings, right? They're like wires in a human body. So if they go and they press on these nerves, and then you start to have these symptoms, like current running down your right leg or the left leg, and that's what you have.
Okay, but can it go back to its original?
Well, yes, It can. I mean, there are various procedures. I mean, it depends. First, you have to have one which has slipped. Then, if you have one which is slipped, we need to know how badly it is slipped. So, and then if it's really very bad, then it needs to be put back.
Okay.
It could be done without surgery and even with surgery.
And going back to the chiropractors,
Yes.
because I've been seeing a lot of videos
Yes.
of chiropractors just doing all these medical stuff, of course,
Right.
to their patients, and then
Yes.
the sound
Yes.
of the bones
The cracking,
just
yes.
cracking.
Yes.
So it just gives them relief. So I've never
Yes.
had an experience like that. But can that be experienced by someone who just wants to feel relief on their back, or?
Yes, if it's stress-related pain, back pain again, stress-related spinal pain, upper back pain, lower back pain, without any underlying medical major problem. I mean, your bones are fine, your disc is fine, but still you have pain. This is then mechanical, right? Lifestyle-related.
Yes.
Then probably with a mix of exercises, a chiropractor could be a good guidance for you.
Okay.
Yes.
So thank you for that, Doc. For my next question, does work stress, like work stress, mental stress, or stress in general, can that alone be a contributing factor in the pains that we experience in our muscles and our joints?
Yes, always. Yes. It
Just
does.
stress
I mean,
alone,
see,
yeah.
I mean, stress. Some people, you see, we are all same. You, me, everyone. We all are same, but we are still different, right? And I mean, stress works in different ways. Some of the people, if they are stressed, they eat more.
Yeah.
Some of the people, they are stressed, they eat less. Some of the people who are stressed, they sleep more. Some
they don't
sleep
go
less.
out.
They don't go out.
Don't exercise
the
anymore.
same way, some of the people who are stressed, it will reflect on you in terms of pain, tired, being fatigued, irritable, back pain, muscle pain, fleeting pain here and there. Yes, mental stress can reflect in it can also cause gastritis, heartburn. Mental
Yes.
stress is a very major
Just in your
cause.
overall health.
Mental stress is a
Yeah.
very major cause for causing acidity. If you're mentally stressed, not physically, mentally stressed. Mental stress can be domestic at home, or it could be at work or anything.
Yeah.
So yes, it can reflect as back pain. It can, or generally pain, muscle pain. It can reflect.
Doc, I just want to ask, is it, I mean, for your patients, like for example here in Qatar, who experiences the lower back pain more? Is it women or in men, or does it matter?
Well, I haven't particularly observed about gender-wise.
Yes.
Well, I would say more with lifestyle, more with,
so it's more in the lifestyle.
how active you are. Well, I mean, if it's a female, if the patient is a female and she's active, she's fine, she's exercising, and then it's less likely that she'll have these pains. You know, fitness is a very important factor.
So that's
Yes,
one
generally
of primary.
speaking. Yes, primary. Yes, correct.
Yes. So, Doc, generally, what is your advice to everybody who is listening to us right now and are experiencing all these pains in the lower back and the knees and the shoulders? So, just your last advices for them,
Yeah.
your reminders.
Well, a bit of aches and pains we all have. At the end of the day, once you retire back home, you're tired. Everybody has, but with the sound sleep, with the rest, with a good meal, you're fine, and you're ready to work the next day.
Yeah.
Right? So if it's like that, it's fine. But if it's a pain which has been going on since a while could be a month or more or a few weeks, and then if you have taken some medications over the counter like Panadol or Brufen and still it doesn't settle down, then I think it's always wise and advisable to see your doctor.
See a doctor.
Yeah, of course you Google, everybody does.
Yeah.
I mean, it's there. I mean, you read. I wouldn't say not to Google, but people,
Yeah.
they do.
But you can't always trust Google.
Yeah, so always seek
a doctor.
help. Yeah,
Yeah,
for your own
it's
benefit.
better.
Yeah, at least a physician or yes, better much better to see an orthopedic specialist, but just see a medical, even if not at least a physician or something like that.
Yeah, because self-diagnosing is
Very
dangerous.
bad. Yes, it's not good.
Yes. So, Sir Doc Mansur, for my last question, is there are there people who you want to greet tonight?
Well, my nurses, my Qabayan nurses in Al Ahli Hospital, they were quite excited that I'm here.
Are they tuned in right now?
Yeah.
Or are they working?
Well, a few of them are working and a few of them are home. So they would really want you to call out for them.
Yes.
And then, so their names, I think.
You want me to mention?
You're quite famous. I would. Yes.
No,
they
I'm
know
not,
your name.
Doc.
Yes.
I just want to say hi to our Qabayan nurses in Al Ali Hospital. Phyllis. Phyllis, Janelle, Julie, Frank, Zalaika, and Oyin.
Yes, correct.
Yes. Good evening to our Qabayan nurses.
Thank you.
Thank you so much,
Thank
Doc
you so
Mansur.
much for having me here.
Yes,
Thank
personally,
you.
I learned a lot tonight.
Yes. Thank you very much.
And this second episode of The Doctor is of course brought to us by Al Ali Hospital, Wakra Clinic. And you can also find Doc Mansur in Al Ali Hospital. He's been working there for 5 years now.
Right.
Going 6, right?
Yes. Yes.
Yes, so is that all, Doc? Maybe you want to greet more people?
Well, I would like to greet Phyllis. Hi, Phyllis, and Janelle, Julie, Zulaika, Oyun, Frank.
Yes.
All of them. These are my
your fellow
Qabayan.
doctors, maybe?
I would like to greet Dr. Stanley Jones. He's the head of the Department for Orthopedics.
Yes.
And Dr. Erki, Dr. Nasser, Dr. Maher, and my other colleagues, Dr. Farhan, Dr. Sumuk, Dr. Balaji, Dr. Kamhavi. And I would like to also thank Mr. Osama from the Business and Marketing Department of Al Ahli Hospital to have given me the opportunity to be here.
Yes.
In front of you all wonderful people.
And what a pleasure.
Yes, it's my pleasure.
It's our pleasure.
It's my first time in the studio room.
Yes.
So it's nice and exciting.
Yes, and I really learned a lot, and I'm not kidding, Doc, because I was really interested to know more about these pains that I've been experiencing. Because as young as I am,
yes.
Is it with the age, Doc, or is it with older people only? Statistically,
age, yes, it can be with age. Especially, I've seen. That's quite an interesting question you asked. Yes, people. Young people are even coming with back pain. That's quite scary, as in, because a lot of people as young as in their 20s, even late like 19 years or
like teenagers
or someone who's in their 20s, mid 20s, they're coming with back pains and disc problems and all these. This, I feel, is again probably the lifestyle. You're more hooked on to the telephone, to the mobile phones, to the gadgets.
To the screens.
You're not going out.
Online schooling
and yes, this again, I think it's again lifestyle. I wouldn't see youngsters back in the 90s to be having this problem.
Yeah, okay. So that's an interesting insight right there, Doc. So thank you.
Thank you.
I'm also glad I asked that.
Yes.
Because sometimes I experience lower back pains also. So maybe one of these days, I'll come to you, Doc.
Sure.
So yes, thank you again.
Thank you.
That was, mga kabayan, that was Dr. Mohammed Mansur Ali from Al Ali Hospital. Such an enlightening episode of The Doctor is in, and I'm gonna leave you guys with a video from Al Ali Hospital. So please stay tuned, you guys. This is Trish on the After Shift. Yes, Doc?
Can you say hi to my nurses in Paula? And
Paula?
Yes.
Yeah. Hi, Paula.
Yes, and Jonathan.
Who else? And Jonathan. Hi,
Yeah.
Paula and Jonathan.
Shirley.
And Shirley.
Jean. Sorry.
Super cute.
Shilpa.
Shilpa.
Yeah. Bina.
Bina.
Bisha.
Bisha.
Yeah, and so many. I don't know. I can't remember.
So to the nurses
Yeah.
of Al Ali Hospital with Doc Mansur. Good evening to you guys. Thank you so much for tuning in. I hope you enjoyed my time with Doc Mansur. Because I really did.
Thank
So
you.
I'm gonna leave you guys with a video from Al Ali Hospital. I hope you guys learned a lot, just as much as I did. But for now, let me take a quick break, and I will be back with more music for you guys. This is Trish on the After Shift, only here on Qabayan Radio 94.3.
فإن مع العسر يسرا إن مع العسر يسرا.
هل خطر ببال أحدكم أن عام 2020 سيكون بهذا الشكل؟
كل شيء قد تغير في دقائق،
في ساعات،
في أيام معدودة.
لم ندرك أهمية النعم التي كنا فيها إلا حين شعرنا أننا بدأنا نفقد جزءا منها. نحن الآن ننظر إلى المستقبل المشرق بعين الأمل والتفاؤل، على أمل أن نكون خلال هذه الفترة قد علمنا فعلا ما هي الصحة.
الصحة ليست صحة الجسد فقط،
بل هي صحة العقل،
وصحة وقوة المجتمع المترابط الذي ما زال على وعده في بناء مستقبل لأبناء هذا الوطن.
فإن مع العسر يسرا، إن مع العسر يسرا.